One common myth about aging in America is that Medicare will cover your health care requirements in old life. It will not. It will cover some of the medical expenses. However, even if they are on Medicare, the average senior may expect to pay for a significant percentage of their health care. The health issues that Americans begin to face when they reach the age of 50 are exacerbated when the high expense of health care stops them from seeking treatment, taking their medicines, or generally maintaining a healthy lifestyle. West Health and Gallup conducted a study of U.S. adults to investigate the many ways in which healthcare expenditures affect Americans age 50 and over today. According to a survey conducted by the Center for Retirement Research at Boston College, half of all retirees spent more than $4,300 on health care in 2018. That year, high-cost Medicare beneficiaries spent more than $10,000. That doesn't even take into account long-term care, which Medicare normally does not cover and was left out of this study. According to CRR writer Melissa McInerney, average Medicare recipients spend 25% of their Social Security payments on out-of-pocket healthcare expenditures. And among the sickest seniors, the top 5% of retirees in terms of spending, healthcare ate up more than 90% of their Social Security benefits. According to the most current studies, more than a third of persons 65 and older are anxious about their ability to pay for necessary healthcare treatments in the next year. The situation is much worse for older Americans who are not yet Medicare eligible, with almost half of those aged 50 to 64 expressing the same degree of fear. Due to the high expense of healthcare, almost 50 million persons aged 50 and older are in danger of developing more serious illnesses or perhaps dying. According to data from the U.S. Department of Health and Human Services, out-of-pocket health care expenses for adults 65 and older increased 41% from 2009 to 2019. Out-of-pocket expenses account for a large proportion of individuals' expenditures as they age due to the increase in demand for health services and the fact that Medicare does not cover all health expenses. When compared to the general population, those 65 and older spend roughly twice as much on healthcare costs, despite the fact that 94% of this age group is covered by Medicare. According to the U.S. Census, if expenditures continue to grow over the next decade, the number of Americans 65 and older will increase at a pace of roughly 10,000 individuals each day. This rapidly rising segment of older Americans, those aged 50 to 64, and joining Medicare, are already complaining about the financial strain of healthcare bills. This burden causes significant proportions of older Americans to sacrifice fundamental requirements in order to pay for healthcare. Around 1 in 4 persons 65 and over and 3 in 10 aged 50 to 64 cut back on food, utilities, clothes, or medicine owing to healthcare expenditures. This difficulty is felt more acutely by elderly women and Black Americans. If you want us to make more videos like this that show you what is happening in America today, please leave a like and subscribe to Economic Empires so we can notify you when a new video comes out. A large fraction of the elderly population manages healthcare expenditures by foregoing treatments and reducing their basic and vital demands. Avoiding necessary medical care will cause lead to bad health effects now and in the future. 12% of those 65 and over, or nearly 6.5 million people, report that they or a member of their family experienced a health condition in the previous year but did not seek treatment owing to expense. 11% of Americans in this age bracket, or 6 million people, said that they or a family member missed prescription medications to save money. Susan Mullingham, 71, of New York, is one older American who has had to forego care. She outlines the decision-making process that some older Americans go through when deciding on treatment. I was scheduled to undergo back surgery, But I discovered that the hospital charge was $350. That would utterly deplete whatever funds I have. So I haven't had the surgery yet, and I'm in a lot of discomfort when I stand up. Acute healthcare challenges face adults aged 50 to 64. Adults aged 50 to 64 have a particularly difficult time affording health care since they are old enough to have health concerns but too young to qualify for Medicare. 1 in every 4 of these people claim they or a member of their family recently did not seek treatment due to the expense. Another 18% of persons in this age range, also higher than those 65 and older, claim they or a family member had avoided prescription medication to save money. For many seniors, the difference in the proportion of Social Security income spent on health care has little to do with differences in health expenditures. Rather, it is a tale of disparities in Social Security benefits. This is especially noticeable when looking at health care expenses by gender. Medical costs for elderly women are not significantly greater than for males, but their Social Security benefits are significantly lower. According to the Social Security Administration, the average annual Social Security payout for women 65 and older in 2019 was $13,505, while males received $17,374. On average, equivalent medical expenditures consume roughly 22% of men's Social Security income. However, they consume around 28% of women's Social Security payments. The same holds true when looking at the percentage of total retirement income. In 2017, the median income for women aged 65 and over was $19,180, while men earned $32,654. As a consequence, female pensioners spent around 15% of their entire income on medical expenses, while male retirees spent 9%. Remember that the CRR analysis only looked at healthcare expenses. They do not include the expenses of long-term care, which is often not covered by Medicare and can dramatically increase the out-of-pocket expenditures for people who require it. Approximately 70% of older persons will require extensive long-term supports and services before death, and more than half will require paid care. And those most likely to require it are those with the fewest resources. Prior to the pandemic, all older persons could expect to pay an average of $80,000 out of pocket for long-term care throughout the course of their lives. A high level of care will cost around $150,000 for those who require it. When it comes to long-term care, women face much greater expenditures than males. This is due in part to the fact that their typical stays in long-term care are substantially longer, about 3 years compared to 2 for men. Long-term care costs are expected to be considerably greater now. Wages for home care aides and facility-based employees, as well as other expenditures, have risen dramatically. The takeaway: when planning for retirement, consider your out-of-pocket healthcare expenditures, even if you have Medicare, and plan for the more than ever likelihood that you may require paid long-term care in your old age. Everything will cost a lot more than you anticipate. According to the United States Census Bureau, the number of adults aged 65 and above will reach 77 million by 2034, up from roughly 52 million currently. As a large percentage of Americans 65 and over confront actual sacrifices to pay for health care, many more Americans will experience health and financial effects due to high expenditures over the coming decade. With those aged 50 to 64 already sacrificing more than their elder counterparts, there will undoubtedly be a large number of older persons who require medical care due to the health consequences of postponing or missing treatment. Healthcare expenses in the United States continue to be higher than in other industrialized nations, according to the Organization for Economic Cooperation and Development, although spending more for treatment does not result in better health results. Policymakers must promptly address ways to increase efficiency and lower costs of healthcare and prescription pharmaceuticals in the United States so that Americans do not have to compromise fundamental needs to pay for healthcare or medicine or forego treatment completely because it is too expensive. If you enjoyed this video, please leave us a like and subscribe.